Have you ever wondered who exactly is behind those masks in the operating room? Hi, I'm Kathy Cheek and welcome to RCC Connections. This time we're going to focus on surgical technology and find out exactly what these students do when they get to the OR.
Put that in, and I need 2 hemostats, please. One at a time. Okay. Grab that right there. I need you to hold that for me, please. And I'm going to need a pair of Metz and Bomb scissors again, please. Surgical technology is it's a diploma program. It lasts a year, and by a year I mean 3 semesters. Students start in the fall. They spend fall semester, spring semester, and the following summer semester with us, and then they graduate at the end of the summer semester.
And besides the OR, which everyone normally thinks for a surgical tech, what other kind of jobs would people who graduate with this diploma, what could they do?
Okay, well, it's true that most of our folks will be employed at some point in time by a major medical center working in a surgical suite. We do have a number of other opportunities for them. Go to work for a veterinarian. We do surgery on animals there. There's very little difference between the instrumentation that is used and most of the anatomy, indeed. Veterinarians. We also have a couple of people this past year who have gone to work for organ procurement systems for North Carolina, which I think is a fascinating job. They both absolutely love it, where they go with the teams when we have a donor and organs are to be retrieved. Then they meet the team at that site and go through that process. In addition, we have certain physicians, plastic surgeons, orthopedic surgeons, who have specific needs, and they have very specialized ways and systems and methods that they use, and often they will employ private scrubs. A private surgical technologist, someone who travels with them wherever they do their surgery and will be familiar with their routines.
And you were also telling me this is a great opportunity for freelance work if folks don't want to have a talk about how that process.
Well, we have the travelers. There are folks who you can sign an agreement. We have a national association that will send traveling surgical technologists if you agree to stay in one place for about 3 months. They will send you there, set you up in an apartment, rent you a car, and pay you a fabulous salary to stay at that one place for up to 3 months and maybe continue that. One of my friends went to Hawaii for 3 months, then went down to St. Martin for 3 months. He had a fabulous time. So the traveling, if you're unattached and you want to get out and see the world, is a perfect opportunity to do that. And I forgot to mention salespeople too. With the technology that we use in the operating room now, implants, when you think about implants and for example, orthopedics, everybody knows somebody who's gotten a new knee or a new hip or something like that. Every time one of those procedures takes place, there is a sales rep in the operating room who is helping the surgeon properly size and fit that particular implant into the patient. It's an extremely technical position, and most of the folks I know who do it started their careers as surgical technologists.
Okay. Tell us a little bit about what folks, maybe fresh out of the program, what kind of salary range are we talking about that they could make? Salary
range for a full-time employee at a medical center, in a surgical center, is going to be anywhere from $38,000 to about $45,000. Of course, it does depend on the size of the institution and the complexity of the surgeries that you are doing. Folks who go into some of these other areas may actually make more. Working for a vet's office, I happen to know they got paid considerably more than they would get paid in an operating room, for example. And of course, the salespeople work on commission, so that's entirely dependent upon how much sales they do.
And what is the job market like for surgical techs?
Excellent. Surgery is recession-proof. People are always going to need surgery, and they're always going to need people who give excellent patient care. And I can assure you that surgeons depend on their surgical technologists to be that extra set of eyes and ears and bring that know-how into the operating room. They are always going to be in demand, and we've never had a student who wanted to work that isn't working.
Scrubbing is something that they do to get ready for surgery, to make sure that bacteria is kept as good as it can out of the wound. The scrub is normally 3 to 5 minutes, just depending on what technique you use. There's a couple of different techniques that they use. They can use the counted stroke method, which is them counting each stroke that they make on each section or plane of the arm and hands, or they can use the the timed method, which is like a certain amount of seconds on each part or plane of the fingers and hand. We use the counted stroke method here, and what they do is they actually do 10 strokes on their finger nails, and they do 5 strokes on each plane of the finger, which is the fingers divided into 4 different planes, and then the hand is divided into 2 planes, front and back. And then they move on to 3 sections of the arm that go to 2 inches above the elbow, which is divided also into 4 planes. So they spend a good amount of time scrubbing their hands and arms. They always use a scrub brush with antiseptic solution on it, and clean their fingernails real good and make sure they cover everything. And if any time during the scrub they contaminate, they usually have to start over completely. So if they were to drop their scrub brush, say in the middle of the scrub, they'd have to start all the way back over again.
Now, talk about the robing, gowning, gloving, because that looked so tedious. I mean, it's very intricate. It's not just go over there and slap on some gloves like we see on TV.
Yes, the gowning and gloving has to be done with them actually not touching anything that's going to touch the patient. So when they're putting their gown on, they're actually touching the inside of the gown, instead of the outside, which would be in contact with the patient. And when they're putting their gloves on, they're actually using like a flip over method. So they're touching the inside of the glove and reversing their hand into the inside of the glove without touching the outside of the glove, which would be in contact with the patient.
So it's kind of a process to learn. It's not just, I mean, this is really a part of the program in teaching.
It is. It takes them usually about 2 to 3 weeks to learn how to scrub. We have labs 6 hours a day, 6 hours a week, every week, and I mean they really spend a lot of time learning how to scrub. The gowning and gloving also takes about 2 to 3 weeks, because you'll find that they contaminate, they'll accidentally drop something and have to start all over, things like that. So it really takes a long time for them to be able to learn how to scrub, gown, and glove without contaminating or touching anything that's not sterile.
All right, now then we went to the surgery part, and so we have different tables. Kind of describe what we were seeing.
Okay, what you have the surgical bed, which is the bed that the patient's on, and then they actually drape that patient out using sterile drapes. They pull a Mayo stand over top of the patient that's also draped in a sterile drape, and that's going to be your instruments that are used the most often or at the beginning of the surgery. Then you have your back table that's going to be a little further back, and that's going to include like your basins, your water, instrument set. You might not use all the instruments in one set for the whole surgery. You might just need a few of them, or you might just need all of one kind. It just depends on what you're doing. But you're always going to have the surgical bed, the Mayo stand, the back table, and sometimes even a ring stand with a basin of water in it.
Now, are there certain ways, kind of describe what the techs are doing once they're in surgery and they have these instruments, then what happens?
Pretty much what the surgical technologist does is they go in at the beginning of surgery and they're going to use sterile technique and set up everything that's going to be used for that case. During the surgery, what they're going to be doing is pretty much a second hand for the surgeon. So if he needs you to pass him something, hold something, assist him in retracting to be able to see better, suctioning, things of that sort. Anything that the surgeon needs you to do, you're pretty much their second pair of hands for that.
And are there certain ways that you hand the instruments to the surgeon?
You always want to hand it to them so that they can use them immediately, so they don't have to turn them around in their hands, so you don't hand them to them upside down, so that they're ready to use. Like they'll be exactly at the point of use, because sometimes you'll find that a doctor is going to be at a place where he can't necessarily take his eyes off what he's looking at. So when he's expecting those instruments, he's expecting to be able to take them down straight to the site and be able to use them.
Now, tell me a little bit about the clinical process that your students will go through.
Okay, our students actually start clinicals in January. They start the program in August and they start clinicals in January. In January, they spend 3 days a week, 7.5 hours a day in an assigned OR. So they really get an extensive training at one particular place. So they learn kind of the ropes, how things are done at the hospital. They pretty much, it's almost like they're starting a career there after they've been there for a little bit, because they learn exactly how certain doctors want things, how the OR runs, where things are, things like that.
Okay.
Then during the second semester, some of them switch to a different hospital, some of them stay, but during summer they have 8 weeks. During the spring they have 16 weeks. During the summer they have 8 weeks and 3 different shifts a week, so it'll be 3 8s. So they spend 24 hours a week at clinical there too. So today we're going to talk about laparoscopic equipment, laparoscopic pertaining to the abdomen. I know y'all have heard of arthroscopic knee surgeries before, things like that. Arthro means joint. Laparoscopic's going to mean abdomen, okay? So these are going to be all the instruments you would use on an abdominal case. So they're going to look a little bit different than your open instruments, because what we're going to do is we're going to take little ports and put it in the abdomen and blow up the abdomen and make a pneumoperitoneum and actually use smaller instruments, smaller incisions to do this. The recovery time's a lot lower for the patient. They're back to work a lot quicker. Plus it's less pain. So the first thing that we're going to need is we're going to need like a video camera system, okay? So we've got our TV monitor here that we're going to use that's going to display our image, so it's going to be like you're watching television while you're doing the surgery. We have a light source and a camera box. This right here would be your camera that you would use. It's got little attachments so you can fit things on it. This is your telescope that's actually going to hook to your camera, and you're going to put this piece right here into the patient. So our picture for this is going to be actually on our TV screen over there. After you get all this in, you've got to have some light, so you'll also be using a light cord. This is actually your light cord here. You would take this piece here and it actually goes to the box and then hook it to the camera here. So this would be your setup that you're going to use to display it on the screen there, okay?
As the technology grew, the need for expertise in that technology grew. And while nurses do fulfill a very demanding role in the surgical suite, they do find themselves needing someone. Think about the advent of laser technology, the ultrasonic technology, the implant technology that we use now. There are so many things that need to run properly during the course of a surgery that it is very beneficial to everyone in the surgical suite to have at least one person scrubbed in at the table who is familiar with that technology, and we feel that need.
Tell me a little bit about why you decided to get into Surg Tech.
Well, I think it's an interesting program. I like the medical field, and I don't have to worry about being outsourced to China because we're going to have surgery here all the time, and people are always going to need it, and even if the economy is bad, people still get sick and still need surgery.
So are you from Rockingham County? Do you live here?
I've lived in Reedsville my whole life.
Okay, great. And so what's your experience been like so far at RCC? I know you've only been in the program a couple of, maybe right out a month, I guess, huh? So
I love it. I like all my classes. Miss Kenton and Miss Tulloch are good teachers. They make the class fun and easy to learn.
So is it hard?
Not if you study. If you study and take your time and review your notes and listen and read your book, then you shouldn't have a problem at all.
So what's been the most challenging so far?
The most challenging is remembering all the instruments.
It's a lot of instruments.
And their parts and where they go and all that. I'm going to do this for a couple of years when I finish, and then I thought about becoming a surgeon's assistant, going back to school and stuff after I do this and get some experience.
Okay. Would you recommend RCC?
Yes, definitely. I like it here.
What do you think makes it special?
The small classes, and you get more personal time with your teacher, and the people here are friendly, and it's just a nice place to be.
I think healthcare obviously is the future. We've got more and more people who need it. We have more and more need for people and qualified people in the operating room, and that's really not going to change. If you are more interested in the technical side of things, I would say that surgical technology is the way to go for you. Plus, it's an excellent opportunity to get into the healthcare system. And once here, you have the opportunity to look around, and if you decide to further your education, you're more than welcome to do that.
Are there national recognized tests, exams that surgical tech students need to take?
Oh, yes, ma'am, there are. The surgical technology program here at Rockingham Community College is accredited by the Association of Surgical Technology, which is the national accrediting body for our discipline. And it is strongly, well, not just strongly recommended, it is actually required now for our students to take the certification exam at the conclusion of their program. More and more hospitals are requiring a certification before they will hire a student, or they may hire a student with the contingency that they pass that exam before they become a full-time member of that hospital.
Caitlin, tell me about your journey to get to where you are today.
Well, I had some medical problems when I was in high school, so I left right before my 16th birthday. I ended up in the hospital for a while, and I went to work after that and worked for a long time. I got engaged, had a child, and I was right before I had him that I decided I needed to do something with my life and set a good example for him. So I decided to come to RCC. I got my GED and did the mom thing. I was the manager of Rite Aid Pharmacy for the last few years and stopped working there about a year ago and just kind of fell into surgical technology.
So what attracted you to surgical tech?
Well, I've always been fascinated with surgery. I think it's phenomenal. My mom's been in the medical field all of her life, and it's something about seeing the inside of how the body works, and something that you can do that impacts everything about the body is just amazing to me.
That's so cool. So tell me a little bit about what your challenges have been as far as learning, because you didn't go to high school and sit in the classroom. You did the GED. So what kind of experience have you had?
Well, it's been kind of difficult. I felt like I've taught myself a right bit of everything that normally you would learn in high school. The English and the math. It's really difficult when you don't sit in a classroom 8 hours a day and learn step by step, but I feel that I've done pretty well.
And what about the instruments? Has that been the biggest challenge for you now that you're in surgical tech?
Believe it or not, the instruments I find very easy to remember. My hardest thing is the scrubbing, because I feel like I'm always touching something or forgetting to scrub a certain part of my arm or my finger. So I'm always really nervous when it comes to scrubbing, because I know that's a very important part, is being as clean as possible.
Did you know that it was going to be that serious when it came to scrubbing and putting on your gloves?
No, I had no idea, because you have a certain way you wash your hands, and then it's a whole different thing to scrub and all the way up to the elbow and not touch anything, and no one can touch you. It's a very long process.
But why do you think the instruments come easy for you?
I try to make it a game for myself, where I look at them and relate it to another word, something that it reminds me of when I see it. And Miss Kenton, she's helped a lot with that, and it makes it a lot easier for me.
And do you want to stay in this area when you get your diploma, or do you have any idea?
Not. I want to leave. I want to go somewhere big, and I really just want to be in a bigger facility. I want to be able to see as much as possible, because they have so many different things that they can do in an OR now, and a lot of that's not down here in smaller parts. You have to go Greensboro, Winston, somewhere further out to see stuff like that.
Do you think that you might go on into some other areas beyond surgical tech, or are you just taking it a step at a time?
I'd like to stay in surgical technology for a little while, get some hands-on experience, you know, learn different parts of hospitals and stuff like that. But I think I'd really like to extend my education. I mean, when I was younger, I always said I'd be a brain surgeon, but I don't see that now. It's be difficult with a small child, but I do definitely think I'll go further.
All right, the phlebotomy program, as you said, it is much more than just drawing blood, but the exact definition of the term phlebotomy means literally to cut into a vein, and the purpose is to access venous blood on the body for specimen purposes. But they do, in fact, do a lot more than that. If you are a certified phlebotomist, you are responsible for collecting any number of different types of specimens for laboratory analysis. Of course, granted, most of our education focuses on the ability to draw blood and do it well. But that being said, they learn the entire gamut of specimen collection, from other body fluids to tissue samples. The phlebotomy program is certified by NACLS. They are approved by a national certifying body, and all of our students who graduate are eligible to sit for the national certification exam to become a registered phlebotomist. We strongly encourage our students to do that. While it is not a required part of the program, they are certainly encouraged, and I know most of them will in fact do that because more and more health centers are requiring that certification. Plus, if you're going to go to the trouble of going through a very intensive training, such as phlebotomy, the least you can do is take that test and prove that you have learned everything that we've taught you in that semester.
So what kind of situations, where do phlebotomists get jobs?
Everywhere, and that is the beauty of it. In addition to working at health centers, because hospitals all have large testing labs and they have teams of phlebotomists that go all over the hospital in all different areas to collect specimens. Also, doctors' offices will have specimen collection. Veterinarians have specimen collection. Anything that's got a vein needs a specimen collector. And that does really open up a world of opportunities for the students. It is truly an entry-level position, and you can find schedules that will accommodate you. You can find full-time, you can find really strange if you want to work in the middle of the night on weekends. I did that for a while when I was back in school. You can find a schedule that will accommodate you there. You can find physicians' offices that will need you a couple of days a week, a couple of hours a day. Whatever whatever will suit you, you can find a way to make that happen.
And what is the job market like for a phlebotomist?
Job market is always good, and because it is an entry-level position, this is usually everyone's first foray or exposure into allied health professions, and often they move on. They will receive this education, they will get into an office, physician's office, and be exposed to what other people do, laboratory technicians, nurses, and make some decisions about wanting to further their education, and often they will continue to do that. And as a result, there are constant turnovers in phlebotomy, and there are always jobs available. They make anywhere from minimum wage up to about $12 an hour. So as I said, a nice entry-level position, but usually it's going to be a jumping off point into something else.
And also you had talked about that you have people who are already in, like nurses and other people who come back to do phlebotomy.
Absolutely, because specimen collection is a specialty in and of itself. Having a degree in surgical technology or nursing does not qualify you to collect specimens from patients. You do need your phlebotomy credential in order to do that. So often we have students who are in other disciplines who will come and receive their phlebotomy. We have lots of nurses who like to do that because if they work in home care, for example, it saves the home care folks a lot of effort if they can send a nurse and not have to send an extra phlebotomist to a patient's home to collect samples. So you're just making yourself that much more marketable, and it's really to your advantage. So we get a number of crossover students who do that.
Ardell, what has brought you to RCC?
Well, actually, I worked at an industry that closed last July, 22 years. I was at American Express, and so I decided I was going to go back to school and get some retraining to do something totally different. My job left, and that left me with some great options. I looked at it as an opportunity instead of a setback.
So what led you to surgical technology? How different from customer service?
That was one reason I wanted to do something totally different. And I felt like the medical field was going to be here. Unlike my job that went away, it's going to be here to stay. And it's an opportunity to get inside an operating room without having to go to medical school and spend all those years in medical school, because I don't have that many years to go that far.
So obviously, since you've been in the workforce for 22 years, it's been a while since you were in a classroom.
Yes, it has.
So what has it been like coming back?
Actually, it was surprisingly easy because I was determined to be focused. When I went to college originally out of high school, I wasn't focused. I didn't apply myself. I really didn't know how to study. And I guess that 22 years helped me to be more focused. And I had a personal goal to make the Dean's List. Last semester, I didn't have to take 12 hours, but I did. And I actually made the President's List. So I'm very excited about that. And it just makes me feel good and makes me know that I made the right decision.
That is congratulations.
Thank you.
Way to go.
Thank you.
So what so far has been the most challenging part?
I think the most challenging, I would say, the instrumentation, learning the instruments. And when I first got my instrument book in the mail, because I ordered my books in the mail, I opened the book and I got scared because I said, oh my goodness, I've made the wrong decision because I cannot remember all these instruments. But then Ms. Kenton made it so simple and we went over it, and I think our lab team is our great lab class is a great class, and we help each other. And so it helped us to settle down, and it helped me to learn a lot. So now it's just keeping my mind on what they were. I go back over them pretty much a couple of times a week just to make sure I have them in my mind.
So do you want to kind of stay in the area, or are you kind of wide open? Do you want to go into an OR? Some of the other options that might be out there? Have you thought about that yet?
Well, I'm looking forward to being in the OR because I grew up on a farm, so I'm used to seeing my daddy slaughter hogs, so I've seen the insides of some things and seen some blood and being caregiver for my parents also. So I'm going to take all that and apply it and see what I can do to help somebody and really make a difference. And I thought about respiratory therapy, but I felt like this was a better fit for me, surgical technology.
Why did you think it was a better fit?
Because it's more, I know both of them are hands-on, but the idea of seeing a human heartbeat, the idea of being able to really affect someone's life and be in that life or death situation, and I think it will be the excitement of it is something I'm looking forward to.
Have they talked about any of the emotional impact that might happen in the OR, like if a patient were to not make it?
We have gone a little bit over that, and I think I can handle that because of the things I have been through over the last few years. And I was a caregiver for my dad. I actually built a house so my mom and dad could move in with me. And so my dad passed in 2009. He had rectal cancer. And so my mom is a dementia patient, so she's bedridden right now. So I think I can handle it.
I think
I can handle it. And, you know, being that close to someone and seeing that process and, you know, just seeing the person and then seeing them leave, I think that's prepared me to be able to handle that when it's someone I'm not as attached to.
What made you pick RCC?
RCC is just a great school. I feel it's the right fit for me because it's a smaller campus, and I wanted to make sure that I was successful. I didn't want to go to a larger school where I might not have gotten as much of the personal touch, and we have great instructors. Ms. Tulloch and Ms. Kenton are absolutely the best. They are the best. I'm so glad I came here, and even in my other classes, everyone has been, it's like they're focused on helping you to succeed.
I think it's a great profession. I've enjoyed it. Crystal has loved it. I hope that my students know how much I care about it, and I can't wait for them to get into the operating room so they can see for themselves what I'm so excited about.
Well, our patient made it through the surgery thanks to the students here at RCC, and it just goes to show you that the students here come from all different walks of life, have all different kinds of experience. RCC can be the place for you too. Thank you so much for watching RCC Connections. I'm Kathy Cheek. We hope you join us next time.